Have dark puffy circles under my eyes, in addition to major asymmetry issues. Suggestions to improve the look of my eyes?
Thank you for your question. In your question, you state simply you have dark, puffy bags under the eyes, and you're asking for guidance on what to do. So, let's start by understanding the anatomy issues, because there's one explanation for the puffiness and another explanation for the darkness. As a cosmetic oculofacial plastic surgeon practicing in Manhattan and in Long Island for over 20 years, this is the problem we deal with every day. And so let's start by learning what's causing the puffiness. The puffy bags under the eyes is typically a hereditary issue, and it's called lower eyelid fat prolapse. This term refers to the fact that fat is normally around the eyes and pushes forward prolapses and hernias, or creates a herniated prolapse. So we refer to it frequently as herniated fat. Addressing this fat requires some type of surgical procedure. There have been many different non-surgical modalities introduced which have all failed completely, and they simply don't work. There is some benefit of fillers in patients who have just a slight bit of fat coming forward, but for most people, once they're seeking attention, they have too much fat moving forward. In our practice, we routinely perform a procedure called a transconjunctival blepharoplasty. This means that what we're doing is we're addressing the fat pockets from the inside of the eyelid. And by doing that, we're avoiding an external scar or incision. We're maintaining the shape and stability of the lower eyelid, a very important factor when dealing with lower eyelid puffiness. And this, in addition, there's no sign that you had surgery. What we do is we'll remove and reposition fat as is appropriate, and you get this nice natural contour as if you never had the fat pockets to begin with. Now, the dark circles under the eyes, when you look back, there are so many different solutions. If you just look for solutions for dark circles, you'll be hit with tons of different creams and some medical or pseudo-medical devices. What essentially is the issue with dark circles has to do with the combination of genetics. So people of olive complexion or darker have a tendency to complain about dark circles, as well as environmental. And when I say environmental, that includes sun exposure, smoking, eye rubbing, various types of stressors. So to address the skin quality or I should say the wrinkling and fine lines that occur with the breakdown of the skin, we try to restore the skin in terms of its health, and we do that with something called platelet-rich plasma. When we talk about platelet-rich plasma, what we're describing is deriving from your own blood, like a simple blood draw that you would get at a doctor's office or a lab, and we spin the blood and we concentrate the critical factors needed for healing. And when this is injected under the skin of the eyelids, it allows the skin to kind of blossom and improves the skin quality by generation of collagen and new blood supply. So for us, platelet-rich plasma has been a tremendous benefit for people who either have the puffiness or come in just for skin rejuvenation. The other aspect of the darkness, it has to do with the relative contour. And a lot of times people say that they have hollows under their eyes. And a lot of times it has to do with anatomy and in terms of the skin and its juxtaposition with the bone or the tear trough, as well as the presence of allergies or sinus issues, which creates kind of like this pooling of blood under the eyes, and it results in a pigmentation that's referred to as allergic shiners. What we do a lot for this is we'll try to enhance the volume by placement of a filler or a combination of a filler such as a hyaluronic acid, Restylane for example, and combine that with platelet-rich plasma, and we're able to fill out the tear trough and improve the skin quality. Someone like yourself, our strategy would be to do the puffy bags under the eyes as a surgical procedure, transconjunctival blepharoplasty, which we perform routinely under local anesthesia with light intravenous sedation. This way you avoid general anesthesia altogether, as well as the use of platelet-rich plasma at the same time concurrently, so that you get not only the reduction of the puffy bags, but you get an improvement in the skin quality. If after the surgery you still have a desire to enhance the tear troughs, we can then do the fillers on the Restylane combined with PRP if it's of any value at that point. So at this point, I'd recommend that you meet with qualified, experienced cosmetic surgeons and learn about their approach. Of course, my bias is I like to get very nice results, quick recovery, and I would like our patients to be very comfortable. So they find that doing the procedures under local anesthesia with light sedation in our practice with our Joint Commission approved facilities makes for a very convenient and seamless experience for them. So most of our patients also, in terms of recovery, are able to get back to work within a week with minimal swelling and minimal bruising. So I hope that was helpful. I wish you the best of luck, and thank you for your question.